कश्चित् दुःखभाग् भवेत्।
Viewers, welcome to Truwellth Health TV's podcast series. Today, we have our esteemed guest with us, Dr. Sushrut Babhulkar, who is a leading orthopedic surgeon from Nagpur and the director of Sushrut Institute of Medical Sciences. He is a pivotal national figure as he is the founder, president of the Osteoporosis Society of India and the president of Traumacon Society of India. His esteemed international training includes MCH from the Royal Liverpool Hospital, UK, and the prestigious fellowships in joint replacement and hand surgery from the US. Welcome, Dr. Sushrut Babhulkar. How do you feel being on our podcast today?
Oh, I'm excited to face your questions.
Well, as you are very much into it, and we're going to dive into osteoporosis being a silent disease, a silent epidemic. We would like to know, we've heard that it's very underdiagnosed and people come to know only when they get fractures.
True.
So, what is, could you tell us a little bit about the prevalence and why it is detected so late?
So what happens is, because it does not directly affect any human being in terms of huge amount of pain or huge amount of handicap early on in life, that's when and that's why people don't pay attention to it till the complications because of osteoporosis start occurring. Osteoporosis can complicate in terms of having fractures, fragility fractures, which can lead to fracturing of spine, fractures of around hip, and we have always heard that story that neighboring old lady was in the bathroom and she had a fall and she was operated, taken to hospital by an ambulance. What actually happens is when the lady is taking a shower, she turns to pick up the soap, she breaks her hip and then she falls down. So the process actually is reverse. She breaks the hip bone first and then she falls down. That proper rampantly misunderstood that she fractured the hip bone and then she fell down. The prevalence is, it is going to occur in 100% population. It affects mostly females because of menopause hitting all the women and creating hormonal imbalance and thus decreasing the bone density. So it's very commonly seen in women, but it is not that males don't get affected. Males also do get affected, but at a later age than women.
So we evidently see so much of a need gap, yet the treatment is still not at par. So what are your views on that? Why could that be happening?
Treatment is not at par in the sense that because people don't report to doctors for prevention, they report to doctors, orthopedic surgeons after a fall, and then when orthopedic surgeons, we tell patients that you have osteoporosis, needs to be looked after, you have a fracture, then they start treatment. Also in the medical field, for prevention, gynecologists, physicians and orthopedic surgeons together, they need to understand what effective medicines are available to prevent osteoporosis affecting patients or normal persons so as to avoid complications. I think this knowledge as far as availability of various medications, availability of different technologies to diagnose early osteoporosis is still not been popularized. Our fault but I think people are getting aware about it, and people are propagating effective use of medicines now to prevent osteoporosis.
So that really brings us to the vital aspect of founding the Osteoporosis Society of India. I mean, this is a groundbreaking initiative as much as I know. So, what was your motivation really to found it, and what was the basic vision that was, why you really, we know how actively and very, with so much of efforts you founded it. Please share your reflections.
So India is looking at increase in longevity of life. With longevity, with the advantage of increase in life expectancy, also comes the problems that will be associated with increased life expectancy. One of them is going to be osteoporosis and osteoporosis related complications, thus fractures. The problem which I found as an orthopedic surgeon is, if I start or initiate some treatment, not essentially that will be followed by the patient. The patient might be confused by other doctors, maybe gynecologists, maybe general physicians, maybe family physicians, of the treatment that is been started for that fragility fracture treated patient. So we found the void in understanding amongst ourselves, which are different branches of medicine, as to effectively follow one common pathway for that particular patient, for that particular severity of osteoporosis. And that's why we thought that we all should come together, various branches like gynecologists, like general physicians, orthopedic surgeons, trauma surgeons, rheumatologists, endocrinologists should all come together to formulate one common guideline which will be followed by every one of us. So we are trying to bring in various national bodies, associations like FOXI, like ISBMR, like Trauma Society of India, who can sit across the table, agree on one common guideline, and propagate and promote these guidelines amongst us as treating doctors.
Well, with that, you really answered my next question, because the way the Osteoporosis Society of India is uniquely positioned so that you can get the orthopedicians, physicians, gynecologists, nutritionists, and all the fraternity together and put together algorithms. What would be the message you would actually want to put across so that more and more of these specialities come together, or are there any challenges when you are actually coming together?
Try to believe that beauty is bone deep. We have to look after young ladies. We have to make sure that their peak bone mass, which gets formulated and stabilized when they are 15 to 35 years of age, if we raise their peak bone mass adequately at that age, their being hit by osteoporosis occurrence during perimenopausal period will be less. Let's start understanding better the science behind osteoporosis. Let's try to understand the medical treatment to be offered to every one of us, friends, relatives, when they are yet not the patients. So once we do that, once we agree on a common platform of taking preventive measures for good bone quality, I think we should be with that.
Absolutely agree with you with the fact that beauty is bone deep, because what we women especially don't realize is that once bone and muscle gets weaker, we get more prone to also other metabolic diseases. So this is such a key point that you brought across, and which is why Truwellth is really very keen on promoting this initiative of yours. If you could break down the goals, the short-term goals for us, so that we can also, and the viewers who are listening in also can join in to this mission of yours.
I think the most important thing to understand is diagnosis and prevention. So if we are able to diagnose osteoporosis early in elderly population, and if we are able to prevent occurrence of deficiency of calcium, vitamin D and B12 in our population when they are still young, if we can promote role of exercises and good balanced diet in our nutrition, I think that should be our goal short term. Once we achieve that, what we should look at is, of course, the entire country having one common goal, which is having a good bone health.
Again, you really answered my last question on this podcast today, but I'd still want to know, what is your long-term vision when it comes to the Osteoporosis Society of India? What is the kind of legacy that you hope that we can take forward when it means, controlling, preventing osteoporosis in India and as well as the world?
I think it's not only about increasing the life expectancy or longevity of life, but it is increasing longevity of good quality of life. And good quality of life will mean that you are offering all our population at large to stay healthy till they are alive. So that should be our goal as good doctors and as good medical professionals. And of course, I'm glad you're taking this interview via your medium and trying to promote what our idea is, what our goals and aims and ambitions are as far as Osteoporosis Society of India is concerned.
With that, I think we come to an end to this short interview with Dr. Babhulkar, but I'm sure we are going to keep doing more programs on these lines. I would like to thank you very much for taking time.